I'm continuing the conversation on veteran stand-up with Mike Stoddard, the National Service Director of the Wounded Warrior Project. Well, Mike, I know that WWP assists veterans with PTSD through something called your Warrior Care Network. Can you tell us about that?
Yeah, so the Warrior Care Network is the one thing that separates us from other veteran service organizations. We use 4 hospital centers across the nation in Chicago, Boston, Los Angeles, and Atlanta. And we provide intensive outpatient programming for our warriors, post 9/11 warriors that have PTSD or symptoms of PTSD.
Okay, well, tell us about the program. Specifically, tell me about the results a veteran gets.
Yeah, so the Warrior Care Network is really, in a sense, a 1 year worth of counseling within 2 to 3 weeks. It's really an intensive outpatient program. And it just doesn't focus on your counseling, it also focuses on other things that make you successful and through your treatment. So things like mindfulness, yoga, peer to peer integration. Also, really big about having families take part in this with you. So it becomes the holistic care, not just the individual veteran or warrior.
Okay, well, the big question is, what does this cost and how is eligibility determined?
Yeah, so really this is at no cost. Really, it's about time. It's about 2 to 3 weeks of a process, depending on where you go. And really, Wounded Warrior Project does everything we can to take anything away from the veteran that would stop them from going. We provide them resources. We help them if they have a financial issue or problem. Really, our job is to make sure that the veteran and the family can come to Warrior Care Network and really take part in this intensive outpatient program to really gain their holistic health and to really come out of it better. And I will tell you, having just been through a program very similar at Emory, I found it very life-changing. And that's what the results we generally see from our warriors that attend.
Okay, well, give us some advice to our veterans who care about a buddy. They sense something is unusual and they want to suggest maybe this is something they should look at. How should they do that?
Yeah, that's a great question, Paul. I think, first of all, we got to be okay to have the question, ask the question. If you see that your buddy or somebody that you're around maybe isn't acting normally, maybe they are getting frustrated, maybe they're getting irritated, maybe they've started to isolate, reach out, ask the question, ask how they're feeling. But in the end, if you don't know, come to us, come to Wounded Warrior Project. Let us connect them to a professional that can help them with whatever's going on in their life. Because ultimately, our job at Wounded Warrior Project is to connect them to resources, serve them, and empower them to have a high quality of life. And the Warrior Care Network is an incredible program that really helps our veterans with PTSD come to that holistic quality of life.
Okay, and then how do they connect with Wounded Warrior Project?
So they can go to our website at woundedwarriorproject.org, or they can call our resource center, which is at 1-888-997-2586, and they'll get you connected.
Thank you. And we'll put those numbers and the website in the comments too.
Appreciate that, Paul.